Denial of your terminal illness is common and normal. It shows itself in different ways, such as refusing to accept the diagnosis, having no emotional reaction to the illness, and refusing to accept treatment thinking that you'll be okay without it. And this is fine at the beginning of diagnosis, and we work through it. But it becomes an issue when the denial doesn't shift, when medical staff are telling them you are dying. Their own body is telling them you are dying, and they still insist they're not. Before we begin, we post death and dying related videos every Friday, so if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk death denial in dying patients. It's hard to imagine that someone suddenly starts having regular seizures and coughing up blood and then would refuse to believe that something's amiss. But it happens. Now, these two symptoms could be a sign of stage 3 or 4 lung cancer, but it could also be a sign of something less serious. And a quick Google search will tell you this. And that's part of the problem. It's easy to be in denial when there is an equally plausible better option. But when you go to the doctor and they run all the tests and scans that they need to and prove that yes, it is stage 4 lung cancer, and if you don't get immediate treatment, you'll be dead within a few months, and you're still in denial, that is a very solid death denial right there. Now, that's hard to wrap your mind around, but it's very common. But try wrapping your mind around this one. They've gone through all that, but they didn't get treatment because what does the young doctor know? So now they're dying. They are having more seizures. They're finding it hard to breathe. Fluid build up in the lungs. They're still coughing up blood. Extreme pain when breathing. Fatigue. Constant migraines. Weight loss so their joints hurt. They're fainting whenever they stand up. The list goes on and on and on. But according to them, still not lung cancer, still not dying. They end up in the palliative care ward or somehow in hospice, and they are still arguing with everyone that they don't need to be there, they're not dying, despite it being explained multiple times from every angle by every type of medical professional, family member and friend. They are there, say 2 months, they take their last breath, still insisting they're not dying. It is bonkers to think about, almost unbelievable that someone could be in that much denial, but it's surprisingly common. Denial in the patient. Denial is refusing to acknowledge the facts in front of you. It is different from not understanding the facts. Let's make that clear. And initial denial of your terminal illness and that you are dying is common and very normal. Kubler-Ross explained the stages of grief back in the 60s. And yes, if you weren't already aware, the stages of grief that we all know, denial, anger, bargaining, depression, acceptance, were never meant to be associated with the grief of losing a loved one. They were meant for this situation, the stages of grief a terminally ill person goes through when they're accepting that they're going to die. But some people get stuck in the denial phase and never leave it. So could this end up happening to anyone? Or is it only a certain type of people that end up with this denial? To be blunt, you see this level of denial in people that you would expect it to come from. You don't go from a logical, emotionally intelligent person to complete denial until the end. It doesn't work like that. And yes, brain tumours or dementia can make people's personalities completely change, but not in this particular way. The most common type of person to see this in are those that are used to being in control of everything. Now I say that, and I know the young people are going to jump on the bandwagon and go, oh, she's talking about the abusive types. No, sit down. Let's take a farmer for example. They live in quite a rural area and farming is expensive. So they are used to sorting things out for themselves. Machine broken, you fix it. Sheep in trouble, you deal with it. You injure yourself, you sort it out. You rely on yourself for everything. You make all the decisions and the consequences are all on you. And farming is often generational, so you were often brought up that way. It's ingrained in your psyche. And if you die, the farm no longer exists. So there's a certain amount of stubbornness that needs to come with the job in order to be successful and get through the multitude of hard times. Now, obviously, not all farmers will react this way when faced with the death. This is just an example of the type of person we mean when we say needs to be in control. Another type of person who likely ends up in this situation is those who have a deeply ingrained habit of projecting strength rather than vulnerability and of summoning denial in order to cope with extreme stress and trauma. These people have often been through something huge and negative early in their lives, and this is how their brain now copes with things. Again, this denial is not going to come out of nowhere. Family will see it coming. It's just another situation to deny in order to maintain the strong facade. And in this situation, after months of showing them the facts, showing them the symptoms, having them acknowledge that they don't feel okay, but still insisting that they're not dying and often saying they're not sick at all, there isn't much anyone can do, not the family or the staff. The mere fact that they're in hospice or palliative care is considered a massive win, because most of these people who stay in denial often die at home, and by that I don't mean the good death kind of way. But doctors in hospital experience this a lot. And of course, they usually bring in the psych, like me, to work our magic. And we have to tell them we're not magicians. That kind of patient is going to hate talking to a psych, much more than a doctor. But sure, let's give this a crack. Seriously, some people think that psych can see into your brain and make you do things. And I don't know what the hell kind of sci-fi crap they've been watching, but it's not true. But in the case of denial, we try, often many times over a period of months, using every tactic that we have and make no progress. And at a certain point, there is no point trying to convince them otherwise. You are not going to save everyone. Not everyone is going to die well. In fact, it could be argued that staying in denial is what's best for these people. But the reason we try so hard to get them out of denial is often for the family, the ones that are going to have to live with the consequences when the patient dies. Staying in denial right up to the end means that the family don't get to say a proper goodbye, ask last questions, express their emotions. And if they do try, they are often dismissed or yelled at by the patient. The family will often not hear "I love you" or "I wish you the best" or anything like that from the patient. So there's no closure. Additionally, these patients will often refuse to complete a will or any sort of legal paperwork, or even say how they wish their estate to be divided or managed, which means the family is going to be in for a world of hurt when it comes to dealing with the court system and any family drama, especially if there was a business involved. Funeral wishes will also likely not have been spoken about, so many families feel guilt and not being able to give the patient the funeral they would have wanted. They often don't even know if the patient would have wanted a funeral or if they wanted to be buried or cremated. It's just a big mess, and it makes the grieving process just that bit harder. And I see it happening in real time when I work at hospice, and then we go and do workshops out in the public, and you hear the experiences of these family members many years later, and there is still a certain amount of resentment and sorrow there from not being able to have those last conversations because the dying loved one wouldn't allow it. Now, I should say here that while denial is often a negative, it can be a positive in certain situations, particularly at the beginning of a diagnosis. Think about it. You've been told that you have a horrible disease and it's going to kill you in 2 years. For certain people, if they accept that, they will slip straight into depression and not bother to live those next 2 years. A certain amount of denial allows them to keep living productively, but in most cases where denial is a positive, there is often a regular swing between denial and understanding, and that's what makes it functional. Denial in the family. As a side note, there is a flip side of this, where the patient understands their situation, but their loved ones are in denial of their situation right up to the end. And as a psych, I find this much more frustrating. And I've noticed it being projected on TV shows as well. And I was recently binge watching NCIS, and there were multiple episodes of past or present Navy personnel who are in hospital with a terminal illness, actually dying. And Gibbs, the main character, an ex-Marine, is almost yelling at them to fight. You fight, Marine. Talk about a guilt trip. They are not sick or injured, they are dying. They can't do anything about it, they can't fight it. And I know if you join the military, you have to suddenly start thinking, feeling, having the opinion of the military, and you're now just a cog in the machine. But they're not a cog, they're not a machine, and heaven forbid these people are human. It's not helpful to be yelling at them, telling them to fight. And we see family members do the same thing in hospice. And if you're wondering, yes, some of these family members are ex-high-level military, but most aren't. Now, you might say, well, if the patient was a soldier, it may be appropriate to speak to them like that. But none of my patients have ever been military or ex-military, so that just goes straight out the window. Yelling at your dying family member to fight is extremely distressing for the patient and just makes you look like a horrible, deluded person to everyone else in the room. But there is another angle that this issue comes from, and it's family that have obviously watched too much of these what we'll call toxic positivity medical shows, where the family is overly positive to the point of being completely deluded and believing the medical professionals can fix everything and praising the doctors like they're gods, like they will make some miracle happen. As a staff member, seeing this in hospital is bizarre. Seeing it in hospice is infuriating. They are the ones telling the patient, who is literally dying, how much fun they're both going to have together on the next holiday, or how the patient's kids are so looking forward to having that person at their wedding. These are the people telling the dying person to look on the bright side and think positively, like that's somehow going to fix everything. Now, the two types of family that I've just described, I will clarify, it's usually not the whole family. It's usually just one very in denial individual. So not only are they causing the patient distress, but also all the other family members. And the individual will often refuse to leave until the patient gets better. It's one of the reasons we have security to keep these people out, because at a certain point, enough is enough. Honestly, I would prefer to deal with a family feud erupting than this crap any day of the week. This level of death denial, refusing to accept that you are dying right up to the point of death, it doesn't happen often, but it happens often enough. If your loved one is in denial of their situation, ask yourself, is this in line with their personality and how they usually handle challenges? Because if it is, you need to prepare yourself for them to never accept it, and that the likelihood of you getting closure by way of last conversations is probably not going to happen. We have found that writing your thoughts and anything you would like to say down in a letter and leaving it on the patient's table can be helpful. They may or may not read it, but you've gotten it out of your system. And secondly, lean on your support network, most of whom will probably have a lot of the same feelings in this situation because they are in that situation. And on the flip side, if it is your family member that's in denial and causing problems, don't feel guilty about calling security to get them to leave. And with that, go talk death.